Right now, as you're watching this video, 537 million people around the world are living with diabetes. That's more than the entire population of the United States, nearly doubled. And here's the terrifying part: 1 in 2 of them don't even know they have it. Diabetes is not just a sugar problem, it is one of the leading causes of blindness, kidney failure, heart attacks, limb amputations, and premature death worldwide. And yet, it is largely preventable, in some cases even reversible. So today we're going deep: types, causes, symptoms, risks, and what you can actually do about it. Stay with me, because this video could genuinely save your life, or the life of someone you love. At its most basic level, diabetes is a condition where your body cannot properly regulate blood sugar, also called blood glucose. Here's how it normally works. You eat food. Your digestive system breaks carbohydrates down into glucose, a simple sugar that is the primary fuel for every cell in your body. That glucose enters your bloodstream, your blood sugar rises, and this triggers your pancreas, a gland sitting behind your stomach, to release a hormone called insulin. Think of insulin as a key, and think of your cells as having locks. Insulin fits into receptors on your cells, essentially unlocking them, allowing glucose to flow in from the bloodstream. Your cells get energy. Blood sugar comes back down. Perfect system. In diabetes, this system breaks down. Either the pancreas doesn't produce enough insulin, or the cells stop responding to insulin properly, or both. The result? Glucose builds up in the blood, unable to get into the cells where it's needed. This chronically high blood sugar, called hyperglycemia, is what causes all the damage. Type 1 diabetes is an autoimmune disease. This means the body's own immune system, the very system designed to protect you, turns against you. Specifically, it attacks and destroys the beta cells in the pancreas. Beta cells are the only cells in your body that produce insulin. Once they're gone, they're gone. Without insulin production, blood glucose has no key to enter the cells. It accumulates dangerously in the bloodstream while your cells starve for energy. Without treatment, Type 1 diabetes leads to a life-threatening condition called diabetic ketoacidosis, or DKA, where the body begins burning fat for fuel, producing acidic byproducts called ketones that can be fatal within days. Type 1 is most commonly diagnosed in children, teenagers, and young adults, which is why it used to be called juvenile diabetes. But the truth is, it can develop at any age. It accounts for roughly 5 to 10% of all diabetes cases globally. Approximately 8.5 million people worldwide have type 1 diabetes. There is currently no cure, but it is very manageable with modern medicine. People with type 1 must monitor their blood sugar multiple times a day and take insulin at every meal and throughout the day. Modern technology has transformed this. Continuous glucose monitors, or CGMs, measure blood sugar every few minutes automatically, and closed-loop insulin pump systems can automatically adjust insulin delivery. But it still requires constant vigilance. Type 1 is a 24/7 condition with no days off. Type 2 is the most common form of diabetes, accounting for roughly 90 to 95% of all cases. And unlike type 1, it doesn't happen overnight. It develops gradually, over years, often silently, in the background of everyday life. Here's what happens. In type 2, the pancreas still produces insulin, but the body's cells become resistant to it. Remember the key and lock analogy? In type 2, the locks get rusty. They don't work as well. So the pancreas pumps out more and more insulin, trying to compensate. For a while, it manages to keep blood sugar in check. But over time, the pancreas gets exhausted, burned out, and insulin production starts to fall. Now you have both insulin resistance and insufficient insulin. Blood sugar rises. Type 2 diabetes sets in. The biggest risk factors are excess body weight, especially around the abdomen, physical inactivity, a poor diet high in processed foods and refined sugars, age, risk rises after 45, family history, and ethnicity. South Asian, Black, Hispanic, and indigenous populations have higher genetic risk. Now, type 2 is often called a lifestyle disease, and while lifestyle factors are major contributors, this framing can unfairly stigmatize people. Genetics, socioeconomic factors, access to healthy food, stress, sleep deprivation, and gut microbiome all play significant roles. The reality is far more complex than simply saying, you gave yourself diabetes. About 462 million people worldwide have type 2 diabetes, and the exciting news is that it can often be prevented, delayed, or even reversed. Studies have shown that losing just 5 to 10% of body weight, adopting a Mediterranean or low-carb diet, and getting regular exercise can dramatically reduce risk. In early-stage type 2, these changes alone can bring blood sugar back into the normal range. That's not just managing the disease, that's beating it back. Gestational diabetes, or GDM, occurs in 2 to 10% of pregnancies worldwide. During pregnancy, the placenta produces hormones that help the baby grow, but these same hormones can interfere with the mother's insulin action, causing a form of insulin resistance. Most women's bodies can compensate by producing extra insulin, but for some, the pancreas can't keep up, and blood sugar rises. Gestational diabetes develops, usually in the second or third trimester. GDM is serious because elevated blood sugar levels affect both mother and baby. The baby is exposed to excess glucose and may grow larger than normal, a condition called macrosomia, which complicates delivery and increases the risk of the baby developing obesity and type 2 diabetes later in life. For the mother, GDM resolves after delivery in most cases, but here's the long-term warning. Women who've had gestational diabetes have a 7-fold increased risk of developing type 2 diabetes within 10 years. It's not just a pregnancy issue, it's a lifelong health signal. Beyond the 3 main types, there are rarer forms worth knowing about. LADA, latent autoimmune diabetes in adults, is sometimes called type 1.5. It's an autoimmune form, like type 1, but it progresses slowly, over years, and typically appears in adults over 30. Because of this, it's frequently misdiagnosed as type 2. People with LADA initially respond to oral diabetes medications, but eventually lose insulin production entirely and require insulin. The key diagnostic difference is the presence of specific autoantibodies in the blood, which standard testing often doesn't check for. MODY, maturity-onset diabetes of the young, is a rare group of genetic disorders affecting beta cell function. It's caused by mutations in a single gene and accounts for 1 to 2% of all diabetes cases. It often runs strongly in families and can sometimes be treated with specific drugs rather than insulin, making correct diagnosis important. Secondary diabetes can arise from other conditions, pancreatitis, pancreatic cancer, or as a side effect of certain medications like long-term corticosteroids. Now let's talk about symptoms. And this is a critical point up front. Type 2 diabetes often has no symptoms in its early stages. You can have it for years without feeling anything unusual. This is why screening is vital. Type 1, by contrast, often presents suddenly and severely. Here are the classic warning signs your body uses to tell you something is wrong. Frequent urination. When blood sugar is high, your kidneys work overtime to filter out the excess glucose, pulling water with it. You urinate more, a lot more, even at night. Excessive thirst. All that urination leaves you dehydrated. Your brain responds with intense, unquenchable thirst. You drink more, and urinate more, a frustrating cycle. Extreme hunger. Even though glucose is circulating in your blood, it can't enter your cells. Your cells signal hunger. They're starving for energy. So you eat, but the food just raises blood sugar further without satisfying the cell's need. Unexplained weight loss. More common in type 1. With no glucose for fuel, the body breaks down fat and muscle tissue. People can lose significant weight rapidly before diagnosis. Fatigue. Your cells aren't getting the glucose they need. Energy crashes. Everything feels like an effort. Blurred vision. High blood sugar causes the lens of the eye to swell, changing its shape and affecting focus. Slow healing wounds. High glucose impairs immune function and damages blood vessels, particularly the tiny ones that feed healing tissue. Frequent infections. Bacteria and fungi thrive on glucose. People with uncontrolled diabetes are more susceptible to skin infections, urinary tract infections, and yeast infections. Tingling or numbness in hands and feet. A sign of early nerve damage, diabetic neuropathy, from prolonged high blood sugar. Darkening skin in body folds. A brownish-black velvety discoloration in neck creases, armpits, or groin, a common sign of insulin resistance and prediabetes. This is the section I wish everyone watched, because the real danger of diabetes isn't the high blood sugar itself, it's what that high blood sugar does to your body over time. Chronically elevated glucose is essentially toxic to blood vessels and nerves. Cardiovascular disease. The #1 killer of people with diabetes. Diabetes dramatically accelerates the buildup of plaque in arteries. People with diabetes have 2 to 4 times the risk of heart attack and stroke. Heart disease accounts for approximately 50% of deaths in people with type 2 diabetes. Diabetic nephropathy, or kidney disease. The kidney's tiny filtering vessels are exquisitely sensitive to high blood sugar. Over time, they become scarred and damaged. Diabetes is the leading cause of chronic kidney disease and kidney failure worldwide. About 40% of people with diabetes will develop some degree of kidney disease. Diabetic retinopathy, or eye disease. Diabetes is the leading cause of preventable blindness in working-age adults. High blood sugar damages the small blood vessels in the retina. They leak, swell, or grow abnormally. Regular eye exams can catch this early, before vision loss occurs. Diabetic neuropathy, or nerve damage. Up to 50% of people with diabetes develop neuropathy. It typically starts in the feet, burning, tingling, numbness. Loss of sensation means injuries go unnoticed. Combined with poor circulation, this leads to diabetic foot ulcers that don't heal, and sometimes to amputation. Diabetes is the leading cause of non-traumatic lower limb amputations globally. Diabetic ketoacidosis, a life-threatening emergency primarily in type 1. Without insulin, the body burns fat, producing ketones that make the blood acidically toxic. Symptoms include fruity breath, nausea, vomiting, and confusion. Requires immediate hospitalization. And the list goes on. Increased infection risk, sexual dysfunction, dental problems, depression. Diabetes doesn't just affect one system, it affects every system. Diagnosing diabetes is straightforward with blood tests. Here are the key ones. The fasting plasma glucose test. You fast for at least 8 hours, then blood is drawn. Normal is under 100 milligrams per deciliter. Prediabetes, 100 to 125. Diabetes, 126 or above on 2 separate tests. The HbA1c test. This measures your average blood sugar over the past 2 to 3 months. Because glucose attaches to hemoglobin in red blood cells, and those cells live about 3 months. No fasting needed. Normal, below 5.7%. Pre-diabetes, 5.7 to 6.4%. Diabetes, 6.5% or above. The oral glucose tolerance test. You drink a sugary solution and blood sugar is measured 2 hours later. Normal, under 140. Pre-diabetes, 140 to 199. Diabetes, 200 or above. This test is commonly used to screen for gestational diabetes. Now, about prediabetes. Approximately 374 million adults worldwide have prediabetes, blood sugar that's elevated but not yet high enough for a diabetes diagnosis. Prediabetes is your body waving a red flag. With intervention, dietary changes, exercise, and modest weight loss, the progression to type 2 diabetes can be delayed or prevented in up to 58% of cases. Don't ignore this diagnosis. There is no one-size-fits-all treatment for diabetes. It varies significantly by type and individual. For type 1, insulin is non-negotiable. You need it to survive. Options include multiple daily injections using long-acting and fast-acting insulin analogs or an insulin pump, a small device worn on the body that delivers continuous insulin. The gold standard today is the closed-loop artificial pancreas system, a CGM paired with an insulin pump that automatically adjusts insulin in real time. For type 2, first-line treatment is usually metformin, one of the oldest and most studied diabetes medications, which reduces glucose production in the liver and improves insulin sensitivity. Other drug classes include SGLT2 inhibitors, which protect the heart and kidneys, and GLP-1 receptor agonists, like Ozempic, which lower blood sugar, reduce appetite, and promote weight loss. For gestational diabetes, first approach is dietary modification and blood sugar monitoring. If that's insufficient, insulin is used. It's the safest option during pregnancy. And there's genuinely exciting news on the horizon. Stem cell-derived beta cell transplants are showing promise. Immunotherapies to halt the autoimmune attack in early type 1 are in trials. Teplizumab, the first drug to delay type 1 onset, was FDA approved in 2022. The future is looking brighter than ever. We can't prevent type 1, not yet. But for type 2 and gestational diabetes, the evidence for prevention is overwhelming. Here's what the science says. Maintain a healthy weight. Excess fat, especially visceral fat around the organs, is one of the strongest drivers of insulin resistance. Even a 5 to 7% reduction in body weight significantly lowers risk. Move your body every day. Physical exercise makes cells more sensitive to insulin. Aim for at least 150 minutes of moderate-intensity aerobic activity per week, and add strength training. Muscle tissue is one of the most important sites for glucose uptake. More muscle equals better blood sugar control. Eat a diet built around whole foods. Focus on vegetables, legumes, whole grains, healthy fats like olive oil and avocados, and quality protein. Minimize ultra-processed foods, sugary beverages, refined carbohydrates, and excessive red and processed meat. Sleep well. Poor sleep, even a few nights, increases insulin resistance. Chronic sleep deprivation is an independent risk factor for type 2 diabetes. Adults need 7 to 9 hours, non-negotiable. Manage stress. Chronic stress triggers cortisol release, which raises blood sugar and promotes fat storage. Mindfulness, exercise, therapy, and social connection all help. Don't smoke. Smokers have a 30 to 40% higher risk of developing type 2 diabetes. Smoking worsens insulin resistance and inflammation. Get regular checkups. If you have risk factors, family history, excess weight, over 45, or a history of gestational diabetes, get your blood sugar checked regularly. Catching prediabetes early is your best chance to course correct before it progresses. Diabetes is one of the greatest health challenges of our time, but it is not a death sentence, and for many forms, it is not inevitable. Type 1, manageable with modern insulin therapy and technology. Type 2, often preventable, sometimes reversible. Gestational, treatable and a critical warning sign to heed. The most dangerous version of diabetes is the one you don't know you have. So please, if you or someone you love has risk factors, get tested, talk to your doctor, and share this video with anyone who needs to hear it. Knowledge genuinely saves lives here. If you found this video valuable, please leave a like. It helps this information reach more people who need it. Subscribe for more in-depth health content like this, and drop a comment below. Do you have a personal connection to diabetes? Or a question I didn't cover? I'll see you in the next one. Take care of yourselves.